Welcome to Public Health Matters, where we talk about things that matter in public health. I'm your host, Lisa Vasquez, and I'm here today with our guest, Iraida Muñoz. How are you, Iraida?
I'm good. How you doing, Lisa?
I'm doing good. Thank you for being here and supporting me while Bobby's out.
Yeah.
So usually Bobby is here, she's the director, but today I am the behavioral health strategist for the city, and Iraida is the equity officer. And we're going to talk about June. We're in June, and June is Pride Month. So we're going to talk a little bit about some of the activities and events that will be happening this month. So number one is the Pride Parade, which is going to be on
the 22nd. June 22nd, City of Nashua is hosting that big parade. It's a big celebration, and we are inviting all the community to participate, no matter whether or not you are part of the community, the LGBTQ plus community. You could be an ally. You know, in general, we are all supporting the LGBTQ plus community as one.
And it's important to reiterate that the LGBTQ community is part of the community at large. We are one community, and we want to make sure that everyone feels like they belong and they're being heard and valued. So this parade is one of the ways in which we show we're one big community. Nashua is one community, and that we support our LGBTQIA plus members of our community that have that experience, which is beautiful. We also have other activities, so you should read our newsletter. That's one way that people can find out other things that are going on. And I know that Pride parades and Pride events are going out throughout the state. So if this is something that you're interested in, please check out so many places like NAMI, New Hampshire, and other places that are promoting the different events across the state. So if you want to participate in the national one and then keep on with the celebration, please check out all the other cities, what they're doing, what days they're doing them on, so you can continue to grow your community and your resources.
Yes, I know that Manchester's parade is coming up as well, so it's going to be June 15. And that one is also very exciting since it's our next town and we're so close and we share so many resources. I'm planning to stop by and check them out as well. So I encourage people to do the same. It's a lot of fun, actually. I have been in the past in some of them, and it's just a lot of fun. You see a lot of colors and creativity and people celebrating music, food, and also a sense of community, which is what I like the most. As an equity officer, I just decided this year to educate myself a little more about it so I could educate others. So I focus on trying to access resources and learn more about what's out there. And I'm very proud to say that there's a lot of information that is really good information related to the subject. And I am not a subject matter expert in this particular subject, but I can tell you, Lisa, that is very interesting what we find there, and I'm proud to say that our new generation, the young population, is really embracing this idea in a very positive way in terms of acceptance, and not only accepting, but just seeing it as a sense of belonging like any other community. So I'm very hopeful that future generations are going to normalize all this topics that are not necessarily well perceived, unfortunately, in other communities. But the goal from us as public health and the City of Nashua is actually work towards a better education and inclusivity, right? So the city is very intentional in trying to put all these initiatives, not only Pride, but also we have the summer stroll block party going on, also on the
June 15th.
The 15th as well. Yep. And that's an opportunity to engage with all our community members. And that's when you see the beauty of the intersectionality, right? So you see a diverse population coming together to celebrate their town, to celebrate their friendship. There's food, there's also a lot of music and a lot of games and attractions. It's just us as a community getting together. So those are exciting festivals that the city is working on. I'm glad to be part of them.
And I think that's one of the beautiful things about the size of our community of Nashua is that it's a city, so it's big enough so that we have diversity and we have diverse communities that come together and are able to share in their, experiences and things like that. But we're small enough that we can have these community events and we can get to know each other and build those connections. So I think we're like the perfect size because we're big enough to have resources and diversity, but small enough that we can have those really enriching experiences of exchanging ideas.
Yes, I don't want to forget to mention about the Multicultural Festival that is also coming up. That one is in September 14, but it's never early enough to start talking about it. That one is actually very active with that one because we are really doing a lot of work putting together all types of cultures, right, and languages together. So September 14th is a Saturday. That one is going to be a 5-hour event, and it's about just putting people together. Again, the same concept, but maybe the difference will be languages and different ethnicities. But still, we are putting together people just like we're doing with Pride and with the Block Party. So that, I think, it really says a lot because it's also the kickoff for the Welcoming Week in September, and this city is very particular about that subject because we are a welcoming city.
I know, it's so great to be able to say that this is a welcoming community and that everyone who comes here should expect to feel, valued, seen, respected, which I think is beautiful. And with all the activities, again, the biggest part that we like to talk about is that creating community. Because when you create community, when you feel like you belong to a community, when you feel seen, when you know where the resources are, when you're able to call a neighbor if you're having, a difficult time, or you need to figure something out or learn about a resource or whatever it may be, it makes you feel like rooted in the community, but it also decreases your mental health, which challenges, which is something that we keep talking about, mental health challenges and how do we support communities. Because we know that we saw an increase in mental health challenges after COVID, and we want to make sure that communities know that there are resources available, that there is access to services, and that this community understands that this is an issue, and we've been working and rallying around the subject to make sure that we can increase accessibility for all community members.
And it's good that you brought the mental health subject right now because we have been talking about how to put more resources available for different communities, right? But in the end, the mental health subject applies to everything that we do, just like the equity subject applies to everything that we do, especially in public health, but in every single partner organization that is being working with public health, we always talk about the same subjects and how do they apply to their particular mission. And recently there are some projects that we as public health have been putting in place to impact some particular sectors, and mental health is always #1 subject because it's so needed in our community. You were mentioning before, we just had the behavioral health conference that went very well, so I want to congratulate you for that big effort. It was a really well done behavioral health conference, and the topics that we were talking that were very relevant, and it's what we work with this community. So it takes more relevance every time, I think, more and more, and we keep, progressing and learning from the subject. So I think we should continue focusing mental health solutions and make them more accessible, just like what you said with our community.
Yeah, and I think it's really interesting because we obviously work in public health, and public health touches every aspect of the community. When we think about it, it touches the environment, it touches our water, it touches our, housing, like everything that is in the community touches public health. But mental health is just the same. It touches all aspects of our lives, right? So whether we feel stressed out at work, whether we have access to mental health services or even physical services, health services, because our physical health impacts our mental health and our mental health impacts our physical health. So really understanding that mental health is a big part of public health and that it impacts all aspects of our life is really important. I think the more I've been working in public health, the more it has merged to increase understanding that these two things are so important to the community. And really the relevance and the accessibility and the affordability of access to services and having those barriers to services be met, whether it's language barriers or transportation or cost and affordability or, distance that you have to get to get services. All of those things have been really in the forefront in the past few years, especially since COVID. We've been talking about, telehealth to increase accessibility and language services to increase accessibility. But I think one of the sections or sectors or communities that we haven't talked much about specifically is men's health. So it's June and it's Men's Health Month. And yes, we need to talk about men's health physically, men's health emotionally, but also mental health for men, because we see men not accessing help in a timely fashion, whether it's for physical health or mental health. And also like our social understanding or social norms around men asking for help or men talking about emotions or their mental health well-being is also something that we can definitely elevate and we should increase awareness of this month.
Yes, that topic is we are trying to pay a lot of attention with that topic this month, not only this month because it's June is Mental Health Awareness Month, but Men's Health Awareness Month, but also for the rest of the year and all year round, we should be talking more about men and how do they handle their emotions and their feelings. And recently we have been talking about it more, getting ready to this program and other efforts that we're doing as part of public health. And we have discussed on how, and our conclusion is we should continue talking more about it, because as more as we talk about it, as more visibility the subject will take. And also about boys, right? So how do we start making changes for the future, and how do we start making this a subject a little more relevant for the next generations? So in my opinion, if we are mothers and fathers of boys and girls as well, but this month specifically talking about men's health, we should be talking more about how to express your feelings, and that is not a bad thing to express as a boy or as a man or as a young man that you're not feeling well, that you think you need help, and reaching out when it's needed. Or if you feel like something is really not well and you're not feeling well, just voice it out to, if it's a kid, a teacher, or someone that you feel comfortable enough to talk, maybe a coach or someone related to sports that is there, some counselors available in school for those teens. And if you are a parent, a mother or a father, and you do have a kid that you seem to be in need of something else and you really don't know what to do, there are tools available. And there are, options as a parent or as a caregiver to be able to provide for your child and your boy, because mental health is in all of us, regardless your age, your gender, your sexual orientation, your abilities. I feel like the subject needs to be, be talked more. And, that's our effort and our goal is to continue giving that visibility to the subject and getting to where people is so we can start conversations about it, hard conversations.
Yeah, definitely reaching people where they're at and bringing them along. I think for so long we were like, oh, we're going to start from here, and then people will catch up, and that doesn't work. So making sure that we get to the people and bringing them along with the information is really important. So yes, so this month we're going to highlight men's health, but we're also going to talk about men's mental wellness and mental health well-being and accessibility, because the barriers for men are diverse. It's not only the barrier of social norms, like I'm not supposed to talk about my feelings, but then how do you ask for help in a society that says men don't talk about feelings? So that's a big barrier. And then when you access services, there's also the barrier of, sometimes people want to talk to someone that looks like them so that they feel that they're better relating to their experiences. And we also find that there's not a lot of men who are counselors or social workers. And even, again, talking about those intersectionalities, men who have specific experience like LGBTQ, men who are maybe African American or Native American or Latinos or Middle Eastern or Asian, who might have some different experiences and might want to talk to somebody who maybe looks like them so that they can have that commonality of understanding that specific experience that the person is talking about. And obviously, counselors go to school, they learn a lot, they learned how to talk to diverse community members, but is that perception, I think, from the client to be able to see someone and say, hey, I think they might relate to me because they've been through a similar experience. So it's not necessarily that, counselor that doesn't look like me can't relate, because that can definitely be true. There's many great counselors that are, allies to different groups and things like that. But it's just a perception sometimes from the client's point of view, and that's also valid. So we can't just say, well, a counselor is a counselor and they'll be able to help everyone, because there's also like individual connections. So making sure that, I read somewhere that sometimes it can take up to 3 times trying counseling till you find a person and a modality that works for you. And the same thing happens in recovery, or even finding a primary care provider. Like you might go to a primary care provider and you're like, I'm not clicking with this doctor, and you give it a try and it doesn't work, and then you find another one, and there's nothing wrong with that. But that same concept needs to be applied to mental health as well. Like you might not click with the first counselor, that you find. It might take a couple of tries. Sometimes it does feel nice to have someone that looks like you, but you can also find that allyship or that connection with someone else. So making sure you give different people a try and not have too many preconceived notions beforehand is also really important.
And I think that young people, especially young people that are not really aware of resources in our area, or maybe they just don't have insurance. There are some people that really don't have access to insurance, and that's a big barrier as well, and we can talk more about that later on. But the initial contact sometimes is just a teacher, right? It's probably a coach. It's probably a person that helps at school, or just friends, right? Or maybe even more scary, it's all through social media, right? So that those contacts are through social media. So, but this generation is very talented, trying to find their own solutions. They consult everything with AI and with their phones, and they go and find out more like videos. That could be a good thing and a bad thing, right? Because we cannot regulate what they access. But in my experience, what I have seen is they have been able to manage, right? There's a lot more work to do with young people, and there are partners and organizations that really focus on those, such as the Boys and Girls Club and Girls Inc., and then
Nashua
PAL, the YMCA groups. We have a very good community with big resources in the area that really are there. Arlington Street Community Center, there's so many. The library that are there for these purposes for young people, and same thing for adults. Like, the library have great programs for adults, and they try to target different populations just like what we do. So they have clubs that are super interesting. They put, activities and free events together, and now they are becoming more digital as well. So they are getting into that world of digital resources. So what I'm trying to say, that the resources are there, but they don't do anything if we don't know they exist, right? So it's our job to try to highlight those and to get where people in need is, to let them know there are solutions. And this job, we are used to do it, but it takes time to develop that relationship with the community and be a good listeners, right? And not only listen to what's going on, but also bring it back to the office and work on a strategic plan and putting a plan together that works, and to take action. That also takes a lot of effort, and I think we're doing, our best, and I think we're doing a great job, actually. We are seeing good results. Still much more work to do, and I don't think in any means it's gonna go away. I think we have work security there, but I think it's still much more to do with those topics in terms of mental health. And I want to let people know, like, there are efforts that public health is doing in several ways. Not only this program that is great, but we also run the podcast Speaking Our Minds that Lisa is doing in 5 different languages. And I know you can talk more about the last chapters, but it's more focused towards mental health as well and how to access those services. So I think we're just putting it all there. So I'm very proud of the job that you are also doing.
Yeah. And I just want to let people know that there's also other things that we do. These shows like this one and the ones in different languages and the radio show and the podcast are ways to provide education and information to the public. But we're also doing trainings. So one of the trainings that we do regularly is mental health first aid. And we do have them like a few times a year in our community, available for free to community members to learn a little bit more about mental health and what resources we have in the community. Because like you said, if we have resources and nobody knows about them, they're not any good. So making sure that people know about the resources, but also know like how to have a conversation about mental health, because if it's not something that you've gone to school for or that you've had experience with, it can be scary. To have that conversation if you're seeing signs or symptoms or something, someone's acting differently. So what do you do then? So this mental health first aid training kind of guides you through some of the conversations that you can have with somebody, how to, be a little detective and see those subtle changes that people might have when something's going on. And one of the things I love that it talks about is that there's like this continuum of need, right? So not everyone who's having a mental health challenge, for example, needs to go to the emergency room, right?
Right.
So if we find it early enough, people might just need to talk about it. And it could be with a friend, a family member, someone that they, trust. And then it can go to needing to speak to a counselor and having that talk therapy and talking through these feelings and talking through all that. And then like if it progresses and that's not helping and they might need additional support, they might need a psychiatrist, they might need medication, or they might need to end up, you know, going to the ER for that, you know, crisis intervention kind of a situation. But again, it's like a whole spectrum of help. So it's not like, you know, there's only one type of problem and only one type of solution. There's a whole array. And sometimes you just need coffee with a friend. And sometimes you need that really, you know, intense emergency support for your mental health challenge. So making sure that we know that there's a spectrum also makes us feel a little bit more at ease, because if we think, hey, everyone's gonna need a doctor, then we're not gonna be able to help. But if we know that sometimes people just need someone to be there with them, someone to listen, then we know, hey, maybe I could do that.
You were saying levels of care in our podcast. At some point, you were saying that to me is like the level of care. So I was focusing on trying to seek mental health for self-care, for preventing, you know, for just setting in place a doctor, a mental health counselor for myself in case I need it in the future, or just as a maintaining, you know, for my self-care. But you were mentioning that there are different levels of care, and not all of us are in the same stage of care. Would you be able to point out, you know, if someone is in need of care that is in crisis, what will be the best first step to do?
So if someone's in crisis, depends on if some steps have been taken to harm themselves or others. So if that's going on, you're going to have to call 911. If it's nothing has happened, there's no plan in place like to harm yourself or others, then call 988. So 988 is this national hotline that's been set up for people who are having a mental health challenge. You pick up the phone, you dial 988, and you get connected automatically with someone who is trained to talk about mental health. And then we can go a little bit on in another show about like how it can go after you call. But if you remember that if someone's in crisis and they're a danger to themselves or others, you call 911. If someone's in crisis and it's not to that level that they're a danger to themselves or others, you dial 988 so they can speak to someone right away. I think that's the most important thing. And then sign up for our newsletter so you can get more information. We have the Equity Corner that gives you a little bit more information about things that are happening around equity. We have so much information about our trainings and things like that. So there's so much information, but our time is up. So I'm Lisa Vasquez and this is Iraida Muñoz, and we want to remind you to have a great day today and an even better tomorrow. See you in the next Public Health Matters. Bye.